Hi, my name is Dr. Kathryn Martin, and I'm here today with my brother Dr. John Martin and Dr. Edward Martin. And our topic for this segment is bioidentical hormones. Now, many postmenopausal women are turning to natural hormones or bioidentical hormone therapy because of a lot of safety concerns about conventional hormone preparations. There's been a lot of negative press over the past 5 or 6 years.
What does that term mean?
Well, it can actually mean a lot of different things, but for the most part, it means hormones that are from a natural source, i.e. a plant-derived hormone rather than one. People think of a not natural hormone as conjugated estrogens or Premarin. It also means a hormone that is structurally identical to a hormone from the ovary. A real misconception is that we don't have any available products that are bioidentical, but we do. We have an FDA-approved product, estradiol, estrone, and natural progesterone. They're all FDA-approved with excellent quality control, and they're the same hormones that all the bioidentical providers use.
So, if people think that there's a safety issue using the prescription medicines, they basically should have the same safety issues with these bioidenticals.
That's absolutely true, but the misconception is that the only way you can get these hormones that are structurally identical to the ovarian hormones is to go to a bioidentical provider. So what happens is you go on a website or you hear that so-and-so is a provider who will provide me with bioidentical hormones. And actually there's a tremendous theoretical appeal that I'm getting this natural hormone from a natural source. It's just like my ovary. It's the exact same hormone that my ovary makes. Then they will have you go through a number of baseline tests, either saliva tests or blood tests, and then the pharmacist does what's called compounding, based upon my baseline test, is going to make some estrogen, progesterone, maybe a little bit of testosterone, either in a gel, a tablet, a suppository, and then I take that and I do a series of follow-up tests and say, well, you need to a little bit more of this, a little less of that. So it's very appealing to women. It sounds like it might be more effective.
Yeah, it seems to make sense.
It has a lot of theoretical appeal. Of course, it's based on there's no safety data, it has no scientific underpinnings.
And are doctors doing this? I mean, MDs, and they're working with pharmacists to compound them, or who's?
Absolutely. So there's
Okay.
a physician involved, and then there's a compounding pharmacist involved.
Okay.
Some of the compounding pharmacists are really quite good and do the best they can, but there are a lot of problems as well. It's been shown in a number of studies that there are quality control problems. Some compounding pharmacists from batch to batch do quite well. Others don't do well at all, and that's been shown in study after study. There are no scientific data to show that it's more effective than the conventional approach. No evidence that it's safer. And again, I'll say again, we have the same FDA-approved products for these natural hormones. No reason to think it's safer, and it's more expensive. It's an approach that is being marketed very aggressively by some pharmacies, not everybody, and very recently the FDA has begun to take action against some of these compounding pharmacists for making false and misleading claims about the safety and effectiveness of this approach, without having any credible scientific evidence. So I suspect we'll see less and less of this.
And do you have to be an MD to prescribe these, or?
Yeah, you would have to be an MD.
Okay.
You should be an MD or a nurse practitioner. I suspect that you can get these things online, like you can get almost any medication online. But certainly, I would recommend to women. My recommendation to women is to avoid this approach. And when my patients come to me on bioidentical hormones, I understand the appeal. And what we typically do is just talk about it and say, you're getting estradiol, let's just move you to the FDA-approved product where I know exactly the dose that you're getting.
Okay.
You're on natural progesterone, let's just move you to the FDA-approved product again where I know exactly the dose you're getting. So we're actually using the same approach, just with a little bit better quality control.
Now, the prescription medication is also based on sort of baseline tests where you say, okay, your estradiol levels are very low, so we need to give you more than somebody else, or how does that work?
It's a little bit embarrassing in the field of menopause, but unfortunately those baseline tests are not helpful.
Okay.
The problem with putting people through those baseline tests, we know in advance what it's going to show. Estradiol will be undetectable. Progesterone will be undetectable, so it's a big waste of money. And when you give the medication, all we're following is symptomatic relief.
Right.
Okay? There's no good blood test marker to help guide the dose.
So what are the compounding pharmacies using as their, I'm just curious, do you have any idea what they?
They are using levels that are not scientific. They shouldn't be using those levels.
Okay.
It's a waste of money.
All right. So, for many reasons, not a good idea.
Yes.
Okay.
Any other
All right.
questions?
No,
That's it. Great. Thank you.
Thank you.
Okay.